thing. So awesome. Here we are. Charlie from Elko Development here with Mike McCoy. I'll kind of let you introduce yourself, Mike, and we can kind of roll from there. So tell us kind of a little bit about yourself, your background. I also did a little research. You used to, well, one, adjunct professor, and then two, you were a radio host for a while.
Close on TV. I used to talk about sports on TV for a living back when I lived in Texas. So, yeah, I'll kind of get into that. So right now I work at a company called ConsenSys Health. I'm the director of platform integration and technical partnerships. At ConsenSys Health, what we do here is we help healthcare and life science use and understand emerging technology to help enhance their offerings at current state to meet regulatory compliance, privacy compliance, as well as standards harmonization across many different sectors. We also are in the business of creating what we call a health utility grid, making healthcare data as a utility and making that utility as necessary by creating kind of how water is utility to people today. We are creating the pipes and the infrastructure so that healthcare data could be seamlessly sent across many different silos or pipes, as we call it, across given regions, as well as national regions, international regions, etc. So in doing that as a platform integration and partnerships director of that, I help orchestrate and combine all the different offerings. So we have an elevated compute platform within ConsenSys Health that holds on many different products and offerings. And in there, we have the ability to create verifiable credentials via decentralized identifiers through Web 2 or Web 3 authentication methods. We also have the ability to be able to take EHR, electronic medical record or electronic health record data, and be able to send that across many different silos while staying compliant and utilizing that information at rest. And that's what I do for work, right? But I kind of got originally into healthcare and information back in the day when I was in middle school and high school, as my aunt was actually a practice manager at a health system in the Philadelphia suburbs, and I was mostly raised in the Philadelphia area. And in there, I worked as a medical billing assistant. And at that point, I was really taking paper copies of checks and balances and writing them into different spreadsheets and sending them off to the different auditors within the company. And it was such a disparate process. And there was no real medical record system there at the time. And I was really just sending emails and spreadsheets out, and they were kind of one-on-one systems, and it was just highly inefficient. And I did that for a number of years. I actually went to college, though, separately. I was a communication major, a sports broadcasting major. I was lucky to, while in college, have internships with the Philadelphia Eagles, ESPN, what's now NBC Sportsnet. And, I got a job after college talking about sports on TV down in Texas. I covered mostly Texas A&M high school and professional sports in the Houston area. And it was a lot of fun. Did it for 2 years. But I've always, I guess, professionally and kind of my missions and ethos, I've always liked being able to create systems and tell stories of people, of how they're able to work better together. And I'm obviously interested in athletics. I'm interested in sports, and interested in doing things for the greater whole. And so that's kind of my interest and love in sports and competition kind of brought me to blockchain technology as well. When I got out of TV and media around 2014, 2015, I actually came back to Philadelphia and got more into technology. And a lot of my friends in college were working in software architecture or in network infrastructure. And so I figured this is the kind of world I want to explore as well. How I grew my technical acumen was by going to different highly technical meetups, demonstrations, working open source software communities as either volunteer, and then taking online courses and whatnot. So first I got into the world by doing technical recruiting. Then I was in account management and account sales. Then I became a project manager, program manager. And ever since then, I've really been doing building of technical architecture, doing product ownership, project management. Those are my kind of functional requirements in technical teams. But I've I'm an autodidact when it comes to technology. I've been able to learn how to program and code. At one point, I started a software development boot camp here in Philadelphia to help educate others who learn similar to I through open source communities and through web tutorials. And yeah, so, but I found out about blockchain here in Philadelphia by going to different meetups and in New York City from the founders of a company called ConsenSys. And ConsenSys stands for ConsenSys Systems. And in there, they were, one of the founders of ConsenSys was one of the founders of Ethereum. Ethereum is a blockchain network. And with that, they have a cryptocurrency attached to it called Ether. And the Ethereum cryptocurrency kept growing in value around 2017 when I was part of the team. They needed people to just educate others and do kind of technical strategy and assessment. And I was lucky to be part of the team around 2017 as the price of Ethereum went up to, I think, about 1700. And kind of since from there, I've worked in blockchain technical strategy and bringing together networks, consortias. Though right now I'm primarily working in healthcare and life science, and I'm also an adjunct professor at a university hospital in Philadelphia, teaching physicians, clinicians, and people that are associated to health systems how to use emerging technology. But over the years, it's probably because of when I started in doing medical billing infrastructure and writing those disparate systems, I learned over time how to make that whole world a lot more efficient and automated through technology and a little bit more seamless and easier. And it's been a long time coming, though, that the technology has met up to the industry standards.
For sure. And would you say now that it definitely has, linked up with industry standards or kind of on par with each other?
It's definitely not perfect.
Okay.
No, it's definitely not perfect. I would say
but it's gotten there for sure. A little closer.
It's improving to that way, especially in cities and metropolitan areas. Where in rural, so it also depends on your regional demographics, right?
For sure.
So if you're in a rural area, let's just say in Montana, North Dakota, or the middle of Kansas, a lot of times it's a smaller population. You for the most part have different social norms where you can trust maybe 50 to 100 people in your given network, and you see everyone walking by every day in your neighborhood and driving by at the gas station, and you could trust everyone that's in your network. Whereas when you're in multiple cities with larger populations in the millions, hundreds of thousands, that's when you can't exactly trust everyone who may have access to your information. And so in a lot of the more populated regions of the United States and in places all around the world, the use of electronic medical and health records is more seamless, is more applicable, and there's a larger trust factor. Technology, as much as we don't want to say it, it can be somewhat political too. And so technology is very useful for when multiple people are in a given region, but it may not be as valuable for those that are in rural regions, like in the Midwest and the Mountain West, that may not need that type of technology. And so I see in larger populated areas, health tech, information, wearables, Internet of Medical Things, IoMT, is being quite valuable. But in the lower populated areas, may not be as valuable.
Yeah, it's funny you mentioned that. My old chiropractor in kind of a north suburb of Detroit, about 40 minutes north of Detroit, had the classic, you sign in with a pen and paper, and they still had their stackable shelving with everyone's records there on hand on paper. That's funny. You come to, I'm now in the Denver area, just how everything is completely different. Everything's digital. So I guess what years did you really start to see, in year from 2013, 2014 up to 2017 with ConsenSys, where has that growth, like how have you seen that go? Has it gotten exponentially up as the years go, or has it been gradual? What do you talk about that?
I would say because in industries, so I believe finance and healthcare and life sciences are both very similar, yet also very different in a way. Both of them have aspects of valuable information that could be easily compromised, with payment information and then information that's associated with people and their protected health information, your patient health information, however you want to say. They also have the ability to, people feel very strong about those data points, and people feel strong about the amount of money they intake and that it's in their savings account or it's in their stocks or it's in their checking account, right? And And they don't want that type of information to be released either. They take great pride in the money they make. People also take great pride in their health information. And, for whatever reason, they take great pride. It also could be information that can be misused. So for whatever reason, someone has a particular diagnostic or a particular disease or virus, that could also be very compromising if that type of information were in the wrong hands. It also could be very valuable. And so I think in the industries of finance and healthcare, they're highly regulated industries. In finance, though, technology has been able to exceed more and be adapted more because of the fact that it is mostly binary. And by binary, I mean 0 to 1. The numbers kind of correlate, and they're really just numbers games in finance. Whereas in healthcare, in order to equate and create quantitative numbers associated to care, you have to be able to measure them very correctly. You have to go through different scientific methods and really make sure that output is reflective of the given input. And what I mean by that is when we're using technology to measure care, because right now there's technology such as artificial intelligence, machine learning, and different learning and analytical models that are taking in pictures of people and then putting an output. They're inputting pictures and putting an output of what their potential disease or diagnostic could potentially be. And that is highly potentially useful to predict and understand, but it could also be highly inappropriate. And it could also create inference and may predict things that aren't necessarily true about people down the road. So I'd say because of these technologies, payment systems and coordination and operation administrative technology, that has exceeded for sure. And that is mostly valuable because in administration operations, it's only 0 to 1. You just need to get things from one place to the other. They're communication buses. But when you get into more advanced aspects of using technology for diagnostics, for predictions, for being able to help a physician determine care more so than not, that's when it's going to take a longer road, and we're going to have more scientific processes between all of this. I really, for one, I respect real scientists more than anything, because one, we started to put science as a label on so many different things. Social sciences, that's not an actual science. Social science is more of just you're understanding how people work together and operate.
Interactions.
You can't actually have a scientific method to state how every single time someone will react to something, because people change their minds constantly. Whereas there is something as neuroscience, and there are the sciences of in neuroscience, you either react or you don't react to something, and that's biologically possible. But I believe going through the scientific method and scientific process of understanding how, why, and when this technology may or may be valuable is something we really need to focus on it. And that type of technology has come a long way.
Okay, awesome. So kind of going back to ConsenSys a little bit, kind of backtrack a little bit. You touched on it right away, blockchain and blockchain management. So for someone that's relatively unfamiliar, that's learning about blockchain, how do you explain that for dummies, in a few sentences or a quick summary of blockchain?
Blockchain is a way for you to record your actions, transactions, and then given that transaction, when it's sent across either to another person, to multiple people, to organizations, to other platforms or software or applications, you can then have the ability to, as people say, give access or give consent or decentralize that information or that data point or that thing that you are sending across the many different people, places, or things you were trying to send it to. And blockchain's a way to help give that access out to others, and it's also a way to help protect that access and make sure that that access is only held to specific people and that meet your criteria or credential that can access it. So that's the private blockchain, where you can be able to give access to those once you credential and make sure that you trust them to actually use the information you want them to. And then there's the decentralized model, where you get the information out to the whole group no matter what, and you don't necessarily need any credentialing stopgap to be able to make sure that people are accessing the information for the way that you and your governing body or the people that you are associated with can use that information.
Sure. And then that's where you kind of get that crossroads with healthcare, with the sensitive information. So, I mean, you kind of touched on it earlier, but has it really been solving a lot of those problems with blockchain, especially the last couple of years? And do you see that continuing to grow? And heck, I mean, 2021, the end of this year and beyond?
Yeah. I think it depends also where you're coming from in the world. So
Yeah, like you
in the
touched
United
on.
States, for example, we are in a capitalistic society where, for the most part, we make more money when we're able to individually contribute to society more so than someone else. Whereas in a socialistic society like in China, they are fighting for the sum is greater, or the whole is greater than the sum, where decentralizing and giving out more information to then make sure everyone else is abiding by and learning from my information, data points, etc., is highly valuable. And so when it comes to healthcare data information, one hospital at the moment in the United States, if they were to continue to just take in patient information and not disclose that with other hospitals in their given region or nationally, they become more valuable because they have more data information to be able to share or be able to analyze and input and output alpha. Whereas if we were to decentralize that we could be able to have a system that democratizes information more. We have more people being able to learn off of data information across many different people, and then help with duplication issues of data analysis as well. But that's a challenge we have to do socially within the United States. I would say blockchain is not a problem that is technically need to be solved. It is socially or governing need. The governance and the social problems need to be solved a little bit better. And so within healthcare, there are very many private blockchain solutions that are coming out into the market and that are being used for drug discovery with multiple pharmaceutical companies that are benefiting from that. There are some with patient records and electronic medical and health records that are being democratized and helping with deduplication problems. So I'm Mike McCoy. I may go to 5 different hospitals in the Philadelphia area to get certain treatments. Someone could be able to use a blockchain-based system to be able to help understand those differences. For payment and reconciliation and for administrative operation causes, blockchain is enhancing in private networks right now. There are not many decentralized methods that are federally approved and or federally appropriated in the U.S. today. But then in other places of the world, Estonia has a whole remote digital identification system that they've been able to credential and then distribute healthcare payment out to their citizens in real time, so they can be able to help have the finances they need for things like the coronavirus or other things, etc. And so I would say that's one example, but Estonia has a small population where we have over 350 million.
Yeah.
They have about nearly 1 million folks in their capacity. So it also depends. It depends on the region and depends on your looking lens and how you are looking to use this type of technology. But it's absolutely being used and doesn't solve all problems. Putting actual information on a blockchain, storing on it is not great. Blockchains are not meant for speed. They're meant for distributing access, and they're meant for being able to bring multiple parties together. So if you're just creating a blockchain between one party to another, it's very invaluable. Whereas if you're bringing multiple parties and players and companies, organizations, or people to the table, and traditionally they may not have been able to work together because they have some compromising information in their database and their servers and their network, but they want to be able to find value in 1 to 2 data points or information or problems they want to solve together, that's when blockchain can truly be valuable. So within healthcare and life science in particular, there are a lot of blockchain business networks, such as the Synaptic Health Alliance, such as the MetaLedger project, such as Melody, MELLODDY project, that are using blockchain and aspects of artificial intelligence and machine learning to be able to solve these problems that only multiple organizations can be able to solve.
So you touched on kind of the solving problems and how it's working effectively. And you briefly touched on, but what are kind of the biggest pitfalls of that, when they're trying to digitize and use blockchain?
Yeah, so like we mentioned earlier about rural populations compared to more urban populations, it
Yep.
just there's not a digital divide. It's just more of like socially, you and the people around you are how comfortable are you using these type of mechanisms of applications, or whether it's on a phone, whether it's on a desktop browser, whether you have access to a computer, can you afford a computer, how good is your bandwidth, what cities actually have free Wi-Fi compared to in rural parts of the world, or even third world countries. They might not even have, they've never even heard of Wi-Fi or know how to access it or use it. So it really just depends on your ability to fund and be able to pay for technology, and then how to keep it, maintain it, be able to use it at its highest level. I assume, not assuming, I do know that a lot of health systems, they can afford the huge bandwidth, but obviously right now in COVID-19, when a lot of budgets are being cut, sometimes things like an advanced Wi-Fi network will actually be taken off the budget, because we need to be able to help pay for all these different services within the health system budget, because health systems have had to have floors dedicated to solving and helping patients specifically for COVID-19, whereas they're not making money for cardiac patients, they're not making money on elective surgeries, and that's a huge amount of money that comes to them to benefit them in the long run. It's getting tougher for certain health systems that didn't have the funds before to really keep going. Whether they're private or public, it doesn't matter. It's hurting all across the board. So COVID, if you want to think of it, has shown, yes, telehealth systems and remote monitoring patient systems can be highly valuable.
Yep.
But at what cost? And then who are the people that actually have access? So it's no secret that vulnerable populations, or people that actually need healthcare with chronic diseases and that need medical attention constantly, are the ones that benefit more so from a health system being around. But because of all the payment they have to give for their care, they might not be able to afford the technology to help them receive faster access, faster response, etc. And it's tough, because they're the ones that are feeding the system, and by feeding it, they're fueling and paying for most of the solutions. Yet they are also some of the most vulnerable and may not have the finances to receive that same type of care. And I'm not getting political in the way you should govern or fund or create those systems of care, but it has been a tough challenge. And the divide is that, how are we going to be able to, we definitely should help the most vulnerable that need care the most, for sure. But then also, how are we vetting out, and how are we understanding that this person actually truly needs care? And are we using remote systems to vet that out? And then at that point, is that taking us more into a place of being exposed for fraud and fraudulent claims and charges, and people that are fully healthy, but they're claiming that they're not, right? And that just depends on, that's a regional problem as well. And obviously, the more truthful you could be in those things, the more beneficial the system is. But blockchain can't solve, and technology can't solve social problems as much as we may think it can. It more comes down to, do you trust the people who are behind the technology that you're trying to give, receive, and create information to? Because at the end of the day, our biological information, whether it's associated to care, it's very much a part of who we are. And
Yep.
the more we democratize that, the more we in some capitalistic views, give out that value, the less we may, and the less we get paid or reimbursed in that in some type of way, whether that reimbursement's care, or that reimbursement is time and energy, the less people will feel comfortable about giving out that type of information.
Got it. So in regards to kind of digital health records, would you say blockchain definitely helps with that? And like, I guess, what's your kind of position on that?
Blockchain can help enrich those information services, because you can be able to get more people to
Connect and
privately and connect and give access. So it could help. It also could hurt. It's a garbage in, garbage out problem, as you may have heard before, with data information. And with blockchain, it's garbage in and garbage forever, because if you're putting it on chain, it's permanently there forever. Whereas if you're using what we call in the industry a hash function to be able to just call to a blockchain, create a hash, it's a cryptographic hash, and then be able to open that cryptographic hash to then go to another database server, cloud storage repository, then you're able to kind of mitigate and change how you're exchanging the information. But yes, blockchain can enhance, but also can hurt depending on how and when you're suiting it up.
Got it. So kind of taking a quick, again, kind of backtrack here. So you're appearing on a podcast soon. Does that sound correct? It's the Institute of Electronics and Electrical Engineers.
Oh yeah, so IEEE, it's not a podcast, it's a virtual conference series that started actually last month. I'm hoping to host the industry day, where we're bringing together people who are familiar in building systems for blockchain and artificial intelligence with a specific focus in using that technology to benefit medical devices.
Awesome. Is any particular points you're looking to talk about or emphasize in your part of it?
Yeah, I think part of what I'm giving is just the industry overview and how and what businesses and people are using the technology. But we're going deeper into understanding how our systems like artificial intelligence are predicting outcomes of care, and then blockchain is able to democratize and give access to those outcomes of care. And that's really a lot of the focal point, is how are our medical devices really inputting and ingesting correct diagnosis for medical imaging scanning, for being able to have many different doctors operate or be able to have access to multiple patients at once. What is the bandwidth? How much are we letting the doctors actually interact with patients, and how much are we making them just write into medical records, which could be a social burden as well, and no one wants to stay on Zoom calls all day, right? That just sometimes it becomes mentally draining. Well, imagine being a physician having to do that on a 12-hour shift, or doing remote telehealth services. And that's more of the services, not exactly the device, but within devices itself, there is an aspect of using blockchain to protect some of the information that then could be found by AIs, artificial intelligence outputs that can be very valuable. And so that's why the combination of technology can be crucial for industry if we create the proper parameters and the proper access and consent management points in place.
Got it. So I guess going back to blockchain and then yourself at ConsenSys, what are you kind of looking to do in the next, I guess, a year from now? What do you want to say in, October 2021, where you've, grown from now? Kind of what are your, I guess, next inroads, your biggest growth in ConsenSys? What do you see coming up?
I hope we can start to create incentive mechanisms for enhanced privacy in models to send not only data that is analyzed properly, but that is analyzed at its original state at rest. I hope we at ConsenSys Health have built a model through our elevated compute platform, as we call it. Through our elevated compute platform, I hope we're able to create a data model that can take information beyond the firewall at rest to create data sovereignty and have high levels of data provenance where it's originally stated, so there's no deduplication or de-identification problems. And then you're able to help with the problem of how much cryptography will I use to enhance privacy when I need certain levels of accuracy, and that some of our technology can help solve multinational problems, or we can combine different nations together to be able to ingest and understand medical information together, whereas they can only do it regionally before. I hope that we create a system that allows everyone to access medical records while maintaining privacy.
Awesome. And you're certainly trending that way, in your opinion, to be able to say that in October 2021?
Technically, we're trending that way and creating a system and a model that ensures privacy and accuracy, as well as gives you an analytical dashboard and advanced learning models off of imaging and off of combined medical records. But obviously, there's a lot of challenges in those type of systems, and a lot of them are social. and a lot of them are societal in understanding how and why someone would want to be part of this network. So those are probably the bigger challenges we have to abide by.
Got it. And then do you see kind of still COVID playing an impact there? I know kind of one of the biggest things on our perspective, working on app development, is, companies shifting to digital. Do you see that COVID affecting that, in, remote solutions and such, and with ConsenSys or even in your industry?
COVID-19 has created more of a divide than ever, I would say, in how and why people interact to messaging, news systems, etc. I can't predict whether people are going to be fully comfortable with these type of solutions. I just know that because while people have been able to ingest and use more remote systems and applications to provide their insights and care, it also has created levels of mistrust where, especially politically within the White House, they've mistrusted the CDC and the World Health Organization, the Center for Disease Control and the World Health Organization, because of the deduplication problems, because of what they believe to be misrepresentations of data from its original state. And so it's given us an opportunity, but it's also given us, for those that may not be as technically minded or savvy or comfortable, it's given them more fuel to the fire as well. COVID-19, I'm not a scientist. I'm not a doctor. I'm not a medical licensed trained professional. I believe so they will be vaccines, potentially available coming this winter and coming in the spring for those in the most vulnerable states, whether they're older, whether they're people with pre-existing conditions. But for everyday folks that may be healthy, like you and I may not know your health diagnosis, but for myself,
healthy so far, so we'll take it.
Exactly. For those that are healthy, like myself, there probably won't be a vaccine that could be available for me probably until sometime in 2022. So I feel this is my gut feeling, this is my opinion. I feel that we will be in a very similar state to how we were last spring, potentially this winter. And that could really change how we interact with each other for a number of years. And I don't like to use the phrases new normal or this is normal, this is not. The way we interacted in the winter, fall of 2019 may not happen for a very long time, if ever again, because we are going to obtain new social tendencies and new norms. And I can't predict what they will look like. But I can predict that more people will be aware of applications and systems and how they interact with technology. And some of them might be more burned out because of it. And some of them, because there is actually ways you can measure social input to systems like Zoom and like text and like calls and messages, and it'll drive people crazy, or it'll drive people to never want to interact with people with physical people again. But as we know in biological studies, that we need human interaction very much so in order to survive. If we don't, and if certain people do survive, it will be the studies that will come out from that of people that are not surviving with or without human interaction are something that I'm very interested in, especially being a product owner and creating applications and solutions for people over time. I'm very interested as to whether I assume people are going to be more germaphobes, right? We're always going to have like advanced levels of hand sanitizer and hair spray probably for a very long time. But I am interested in the application enhancements or burdens, because we also might have hit application peak in 2019, 2020, where so especially from a social application perspective and other things, where we just burned so many people out that they're seeking other ways to communicate with others and maybe going off the grid as well. I, for one, in the past month and a half, I've deleted all social media applications from my phone. And if I only use it, I use it on a desktop, and I don't have easy access to it. And so I find that to be greater for myself, so I can focus on things that truly matter. And I see a lot of people maybe similar my age or younger demographics too that are looking to do that as well. And I don't know, it could go either way.
Yeah, no, like you said, I think it's a kind of a crucial point you hit on, where 2019, 2020 could be could be the peak of digitalization in a way, with how it's trending, with how much we are on our phones daily. And, actually, good for you. I should probably follow suit and get rid of Instagram and turn all that. Cause when I'm not working, or if I'm just hanging out, even if I have the TV on, we're right there scrolling Instagram on commercials. So no, I certainly.
Isn't that funny too? Like whenever you tell someone that you have gotten rid of a social media application on your phone, they say, "Oh, good for you. I wish I could do that." That's almost always the response I've been getting the past month and a half.
Yeah,
And, it's
I 100. Will I do it? I don't know. Maybe I'll start with like the one I use the least, and then go from there. But it's bad. Like you see, every Sunday.
Exactly, but it shows that maybe these systems have become too addictive. And
yeah,
I'm not trying to preach that The Social Dilemma on Netflix was a show that, or a movie that was fully accurate. It did have people that are part of these early blown teams that are now creating corporate lawsuits against them. So obviously they have a bone to pick. But
yeah,
I think there is some truth to saying that instead of interacting through applications and through FaceTime and through Zoom like we are, there's an inner need or an inner want for us to just interact in person. And we definitely have had less of that the past, 8 months or so. And
yeah,
I see it turning to where in the future we may cherish and may not take for granted those times where we can freely go and see and do whatever we want.
Oh, exactly. Yeah, no, I'm right with you. It's been, wild kind of 7-8 months. So just kind of a couple more quick questions for you. We'll get back to blockchain very, very briefly here. So you mentioned how rural areas too. You're in Philly. I'm in kind of the Denver area, very, very metropolitan, not necessarily rural. Would you say that there has to be almost a universal adaptation, or would blockchain have to be? Is there a missing link in the chain there for it to, work? Does it have to be, kind of a universal adoption, I guess, of it to be effective?
No, blockchain doesn't also have to be adopted in general.
Yeah.
Like I said, blockchain is very valuable when you bring multiple parties together to solve very small problems. If we were to use blockchain wholly as a universal entity, it probably wouldn't be as valuable because one, the speed of interacting with everyone via blockchain at current state, right? Whether it's in version 1.0 or 2.0 that people are looking to get to, net blockchains are never going to be speedy, and they're always going to be very energy and computationally ineffective. They're going to take a lot of computational energy and soak up a lot of that in the world. And as we're looking to create more sustainable systems, so we don't run out of our grids of energy, it can never be a universal solution. But I think in private regional consortiums and maybe having a blockchain network for the state of Colorado, the state of Pennsylvania, or the city of Philadelphia could be very valuable. But having a universal or a national blockchain for a country or state, like we're seeing in China right now, as they're trying to create national blockchain solutions that they have the computational bandwidth, but it's costing a lot of money to run. And the data point that you're trying to interact has to be highly valuable. And what I mean by that is, think of what I meant from the care perspective of data. If you and I, so I'm assuming you're healthy, right? If I were to send out my heart rate data or my oxygen levels, and you were as well, and a lot of people of our demographic, let's just say 30s, 20s, white male, may not be as valuable as someone that has cystic fibrosis, and we're looking to find details of that person to find drugs and to meet drugs and proteins that could help cause a cure, that can help give curation medicine for that. And when we're creating blockchain networks to find out those valuable points of information, that's when it's highly necessary to create these type of systems. Whereas you just have to be able to find the valuable data points that need to be part of a blockchain network and that need to be transacted. And that's when it's kind of valuable.
So how does blockchain kind of interact with other data or other security systems, or are they completely separate? For I guess, systems that don't necessarily use blockchain, is there a way for them to kind of interact or is it?
Yeah, very easily.
Okay, that's
there's
good.
just so there's NIST, National Institute of Standards and Technology, I believe it stands for,
Yeah.
based out of Washington D.C. that has actually created standards in place to connect into blockchain systems through elliptic curve cryptography that
Okay.
that most of these systems are connected to. That verification method is SEC P256K1, and there's other variations of the SEC P25 movement. And yes, there's methods to be able to connect into those. There is a rumor out there that quantum computing will actually reverse engineer all cryptography, and that all blockchain networks now will not be able to then be necessary when quantum computing is valuable to all people in their day and world. But I will say, on the caveat to that, NIST and other governing bodies and research and development companies have created quantum resistant cryptography, where you're not able to get into a specific network or consortia that matches both the red and the blue pen testing type of inferences. So I don't think that's going to be a problem anytime soon. And right now, blockchain systems or traditional security systems, they can easily be adopted either way.
Okay, well, good to know. And kind of last question for anyone that wants to learn more about blockchain or get involved with it, where's the best spot to start?
There are plenty of YouTube and tutorials. For one, we have a ConsenSys Academy is a great educational road stop. You can be able to go to learn all the basics of blockchain, especially the cryptocurrency aspect, but also the technology that's behind the cryptocurrency too. I would say ConsenSys Academy is a good resource for that. But yeah.
Cool. Got the company plug in right there. So
got a company plug in there. Yeah. I don't want to shill out everything, because that's just, no one likes that.
Awesome. Well, hey, that's those are all the questions I got for you, Mike. So again, much appreciated. Thank you for your time, and great having you. And I guess anything actually you want to say?
Build systems of value. Find the people that may not traditionally work together, but commonly know they need to solve a specific issue. That's where this sort of distributed technology comes in. And I'm actually more excited about some of the privacy preserving technology that's coming out within differential privacy and federated learning, which is creating machine learning models predicted by cryptographic principles. Those are the ways that a lot of people that may not have traditionally been able to work together can work together. And I think that'll be highly valuable coming up.
Awesome. Good to know. Hey, well, thanks again, Mike. Appreciate your time.
Thank you.